Hey, my dear Insta and YouTube family, let's study together meconium aspiration syndrome. So, as we see, meconium aspiration syndrome, it happens in 30% of deliveries complicated by meconium staining of amniotic fluid. Out of all cases of meconium aspiration and syndrome, 6% of babies aspirate meconium into lungs. It is so it 6% of babies aspirate meconium. So what happens if meconium is aspirated, and when does it happen? In utero, during delivery, or immediately after birth. So these babies develop hypoxemia and respiratory distress. It is termed as meconium aspiration syndrome. So pathophysiology of it is acute or chronic hypoxia, passage of meconium in utero, and gasping effort by fetus in utero. Meconium aspiration. So meconium may cause partial partial valve effect, and trapping or complete peripheral airway obstruction, atelectasis. Okay, so grading of severity: mild meconium aspiration syndrome less than 40%, and FiO2 requirement for 48 hours. Moderate is more than 40%, 48 hours with air leak. Severe is requiring more than 40% assisted ventilation. So let's just remember, so by aspirating meconium, it's difficult, and it causes hypoxemia and respiratory distress syndrome, and it happens in uterus during delivery or immediately or after birth. So it can be due to acute or chronic hypoxia, passage of meconium in utero, gasping efforts in utero. It may be meconium aspiration as well. What happens in meconium aspiration syndrome and what its adverse effect is? So varying this degrees of respiratory distress is seen: meconium staining of nails, skin, umbilical cord, so depressed, hypotonic, and occasional hypoxic seizure. So we have respiratory distress, lungs are involved, so it is staining nails, skin, umbilical cord. Neurological symptoms may it is depressed, hypotonia, and occasional hypoxic seizures. So complications are persistent pulmonary hypertension, air leak syndrome, sepsis. I just will get back to you with HIE. So X-rays will show. So HI. So X-ray shows